Good afternoon. I'm Ben Haynes, Director of CDC's Division of Media Relations. I am pleased to serve as your moderator today, and I want to thank you for joining us for a conversation about the updated respiratory virus guidance. Joining me today are CDC Director Dr. Mandy Cohen and Dr. Dimitri Daskalakis, Director of CDC's National Center for Immunization and Respiratory Diseases. Our panel will discuss updated recommendations for how people can protect themselves and their communities from respiratory viruses, including COVID-19. Before we get started, I have 3 housekeeping notes. First, closed captioning is available using the icon on the bottom of the screen. Second, I would also like to welcome Marianne Brown, who is the American Sign Language interpreter for this event. For those viewers who would like to see the ASL interpretation, click on the interpretation link at the bottom of the screen and then select ASL. Third, at the end of today's presentations, you'll have an opportunity to ask questions. To submit your questions, please use the question icon at the bottom of the screen. To begin today's program, I would like to turn it over to CDC Director, Dr. Mandy Cohen.
Well, hello, everyone. Mandy Cohen, Director of the CDC. Great to be with you today. Thank you for taking time on a Friday to join us. I know you don't have written information yet, so we want to go through for you today what we are releasing, which is our updated respiratory viral illness guidance. So we want you to know we are streamlining our advice for people on how they can protect themselves and others from severe illness caused by common respiratory viruses like COVID, flu, and RSV. So our goal here is to continue to protect those at most risk for severe illness while also ensuring we have recommendations that are simple, clear, and easy to understand and can be followed. We're in a different place, both in the level of protection people have against these diseases and the tools we have available. We have effective immunizations against all 3 of those major viruses. We have effective treatments for COVID and flu. And we have more information and tools than ever on ways to reduce the spread of these viruses. Looking at data from this fall and winter respiratory season, we continue to see decreases in COVID hospitalizations and deaths compared to past winters, even as we saw continued high levels of COVID spread similar to past years. Weekly hospitalization admissions for COVID-19 have decreased by more than 75%, and deaths decreased by more than 90% compared to January of 2022. And this is important, new information. Amongst those who were hospitalized this past season, over 95% had not received an updated COVID vaccine this season. Let me repeat that. It's so important. Of the folks who went to the hospital this past year, 95% of them did not have an updated COVID-19 vaccine. So again, today's announcement reflects the progress we've been making in protecting against severe illness from COVID. We're in a very different situation, but we must still use the tools that work to protect against respiratory virus. Our updated guidance emphasizes core prevention to protect against severe illness from respiratory viruses. Most importantly, stay up to date with vaccination, which we now have for COVID, flu, and RSV, top line. Second, practice good hygiene, like covering coughs, sneezes, washing your hands often, and cleaning frequently touched surfaces. And third, take steps for cleaner air, such as improving ventilation, opening a window, or gathering outdoors. Additionally, this updated guidance streamlines and simplifies what people should do if they become sick with any of these viruses. CDC's central recommendation here is simple. When you get sick, stay home and stay away from others. This is crucial to reducing the spread of illness and protecting others. Seek healthcare right away for testing and/or treatment if you believe you may have a respiratory virus, particularly if you have risk factors for severe illness. You can return to normal activities when, for at least 24 hours, symptoms are improving overall and your fever has been gone without fever-reducing medicine like Tylenol. Additionally, when you return to those normal activities, we are encouraging people to use prevention strategies for the next 5 days, such as limiting close contact with others, enhancing hygiene, improving ventilation, masking, or testing to curb disease spread. When you get sick with symptoms like coughing, sore throat, stuffy nose, or a fever, please stay home. We recognize that there are certain groups of folks who are at higher risk for severe disease from these viruses. I want you to know you were top of mind for us as we put this guidance together. We all know someone here who is in those categories, some in my own family. So we were thinking of them as we did this guidance. So we're also releasing additional guidance for older adults, people who are immunocompromised, the disability community, pregnant moms, and young children. We can continue to protect the most vulnerable and have simplified guidance for us all. We're in a different situation with the level of protection we have against these viruses and the prevention steps we know work to protect ourselves and others. In closing, I want to reiterate how important vaccination and treatment is in order to protect yourselves and those around you from COVID and other viruses. It's important to note the COVID virus continues to change, just like the flu virus changes year to year. In fact, COVID changes faster. That's why FDA and CDC anticipate an updated COVID vaccine for later this year, just like the annual flu shot. And we've already begun the process for those updates. We need to keep our immunity up and stay ahead of the virus. So plan now for an updated COVID and flu shot this fall. Okay, with that, I want to turn it over for more details to Dr. Daskalakis, who is the head of the National Center for Immunization and Respiratory Diseases.
Thank you, Dr. Cohen. So good afternoon, and I want to thank everyone for joining us today on short notice. Again, my name's Dimitri Daskalakis, and I'm the director for the National Center for Immunization and Respiratory Diseases here at CDC. Today, I'm really excited to share our new respiratory virus guidance. I will cover our goals in developing guidance, the changed reality that has brought us to this point, and the guidance itself. We'll then all take time to answer your questions. As we have continued to evaluate our guidance, we developed updated guidance that reflects our current reality with respiratory disease and builds upon effective strategies so that more people take action to prevent them. We developed guidance that provides practical recommendations that are clear and actionable, that is streamlined across common respiratory virus illnesses, that highlights strategies that effectively reduce risk, and that balances current post-emergency risks with other societal needs. We are in a different place than we were 4 years ago, and the threat of COVID-19 has changed due to a few really important and key drivers. First, we have effective vaccines and treatments for COVID-19, both cutting the risk of severe disease by half. More on that in a moment. We know that the U.S. population now has evidence of immunity to COVID-19, with over 98% of people having at least some protective immunity, either from vaccination, prior infection, or both. But to be clear, it is important that we maximize this immunity by renewing our subscription and staying up to date, as Dr. Cohen said, with immunizations that keep that immunity strong. And we also have other effective tools in the management of COVID-19, including masks, hygiene, and I mean covering coughs and washing hands, steps for cleaner air, and of course, access to tests. Together, these changes in the COVID-19 landscape have resulted in fewer hospitalizations and deaths. As you heard from Dr. Cohen, weekly hospital admissions have decreased by more than 75% from the peak in January 22 and are more similar now to flu. They're in the same range. While COVID-19 was the third leading cause of death in 2021, it's dropped to 10th in 2023. And as you heard, that's a 90% reduction since the peak. Finally, we are also seeing fewer cases of other complications. For example, cases of multisystem inflammatory syndrome in children, or MIS-C, and long COVID have also decreased. So as COVID starts to resemble other respiratory infections in numbers of hospitalizations and death, We have also considered important ways in which COVID-19 and viruses like the flu are different, including long COVID and the toll it takes on communities at increased risk of severe disease. That makes this even more important. It makes it important that we have clear, simple guidance that more people understand and can follow to improve all the complications of respiratory disease. So vaccinations protect against severe outcomes. Dr. Cohen referred to this. I want you to focus on everything in this graph that's not green, because the green really represents individuals who are up to date on their vaccine. In this graph, we know that reductions in COVID-19 associated hospitalizations over time could be even greater if more people, especially those at greater risk, received an updated COVID-19 vaccine. That's why, as Dr. Cohen said, vaccination continues to be the top of our core strategies in the updated guidance. In this graph, among adults with COVID-19 associated hospitalizations in recent history, October to November 2023, over 95%, that's everything but the green, had not received an updated 2023 to 2024 COVID-19 vaccine. In fact, most, about 70%, had also not received an updated vaccine from previous years. Vaccination works. It is one of our core strategies. This slide depicts the broad immunity that the U.S. population now has. On the left, you can see where we were in January 2021, when vaccine had only begun to be available for certain populations. At that point in time, most people in the U.S. didn't have any evidence of immunity as measured by antibodies. The figure on the right shows over 98% of the U.S. population having at least some protective immunity by mid-2023, with most people having protection from both vaccination and prior infection. COVID-19 protection by our immune system is a subscription that we need to renew by making sure we are up to date with our recommended vaccines to keep that immunity strong. Here, we have another visual depicting how the threat of COVID-19 has changed. The orange line that you see represents COVID-19 test positivity, beginning all the way back in January of 2020 through this past month. As you can see, COVID-19 test positivity has remained elevated throughout the past 4 years, and Dr. Cohen referred to other evidence, such as our wastewater monitoring, that also shows COVID is still here, and it's here in levels similar to past year. Now, I want you to focus on the blue area. The blue reflects weekly deaths attributable to COVID-19. You can see there is space between the orange line and the blue line that wasn't there before. COVID-19 deaths have decreased dramatically, even though we still have COVID-19 circulating. CDC's respiratory virus guidance provides practical recommendations and information to help people lower health risks posed by a range of common respiratory viral diseases. That includes COVID-19, not limited to COVID-19, flu, RSV, as well as other viruses. It includes core and additional prevention strategies. This updated guidance goes beyond just COVID-19 and applies, as I said, to flu, RSV, and other respiratory illnesses. That's important because it means that you don't need to know what respiratory illness you have to follow the guidance. If you have a fever or symptoms, stay home and away from other people until you're getting better. One more time. If you have a fever or respiratory symptoms, stay home and away from other people. It is as simple as that. Now, deeper into the guidance, it includes 5 core prevention strategies, which are steps you can take to protect yourself and others from respiratory viruses. As I've said, and as Dr. Cohen said, number 1 on that list is immunizations. Staying up to date with vaccinations is the best way to protect yourself from serious illness. This is also a great opportunity to point out that CDC now recommends that people age 65 years and older get another updated COVID-19 vaccine. The second core prevention strategy is hygiene. Now, that means washing your hands or sanitizing them if you don't have soap and water, and covering your coughs and sneezes. The next is taking steps for cleaner air. There's lots of ways you can do that. It can be by opening windows, purifying air indoors, or focus on gathering outside rather than inside. Now, we're going to move on to what happens if you get sick. First, really importantly, if you get sick, seek treatment if you have risk factors for severe illness. Now, this may require a test, but we'll talk about that in a moment. If you do get sick, again, like I said before, stay home and away from other people to prevent spread to others. So the first question is, how long do you stay home? We know that everybody's different, and the length of time that people need to stay home is also different. You can go back to normal activities after you stay home while you're having symptoms and fever for at least 24 hours, and when both of the following things are true. Your symptoms are getting better overall, and you've been fever-free for at least 24 hours and are not using any fever-reducing medicines. When that happens, at that point, you can resume normal activities, but we're really encouraging you to take precautions for the next 5 days. So just taking more steps for cleaner air, being extra diligent about good hygiene, and then also wearing a mask, physical distancing, or testing. So some other options that you have if you happen to be around people indoors to really help stop spread of the virus or other viruses to people. As I just mentioned, there are a few additional prevention strategies you can choose to further protect yourself and others at any time. These probably sound familiar, and they include wearing a mask with a good fit, keeping a physical distance from other people or avoiding crowded areas where you may be unable to maintain physical distance, taking a test to help you decide what to do next, like getting treatment or taking other steps to lower the chance of spreading the virus to other people. Both the core and additional prevention strategies can be especially important in certain circumstances. For example, if respiratory viruses are causing a lot of illness in your community. If you or the people around you were recently exposed to a respiratory virus, are sick, or recovering from one, or if you or other people around you have risk factors for severe illness, and that includes older adults and younger children, people who are pregnant or pregnant moms, people with weakened immune systems, and people with disabilities. Remember, you may not always be aware of the things that can make other people more vulnerable to serious illness. Core prevention strategies that I just talked about can provide a degree of protection no matter what. If you are unsure about the health condition or risk status of people around you, you can protect them by choosing to use these additional prevention strategies. I want to take a minute to reiterate our guidance for when you have respiratory virus symptoms that aren't better explained by another cause like seasonal allergies. Remember, step 1, stay home and away from others. When for 24 hours, both your symptoms are improving overall, and if you had a fever, that fever is gone without fever-reducing medicines, you can move to step 2. Step 2 is resuming normal activities and use enhanced precautions that we just talked about for the next 5 days. As a reminder, the precautions include taking additional steps for cleaner air and/or improved hygiene, masks, physical distancing, and/or testing when you'll be around other people indoors. Another question is, what should you do if you test positive for a respiratory virus but don't have symptoms? In that case, use those additional precautions that we've talked about, those enhanced precautions, including the core, for about the next 5 days. Before we conclude, I want to take some time to share that we also have a number of special consideration pages in the guidance for people who have certain risk factors for severe illnesses. These include pages for older adults, young children, people with weakened immune systems, pregnant people or moms, and people with disabilities. These pages include an overview of the population and risk, and really focus on why prevention is important for those populations, and also how these populations can make specific plans for protection. So I want to wrap up by saying thank you, and thank you, Dr. Cohen. The past 4 years, I think, have been filled with ups and downs, successes and setbacks. And partners who are joining us today, your partnership as we navigate through the pandemic and beyond has been really critical, and we're incredibly appreciative of every one of you. As I've said, we're now in a new place with COVID-19 and other respiratory diseases. We're excited to move forward with this new simplified respiratory virus guidance that reflects this new place. Thank you. I'll hand the program back over to you.
Thank you, Dr. Daskalakis. We have a few questions that came in from chat, and we'll start off with those first. What do symptoms are improving overall mean?
Yeah. Why don't I start? So again, first, what a great presentation, Dr. Daskalakis. That was terrific. And I hope you will all go to our website and see all of this information for yourself. But as we're saying, if you are sick, stay home. And what does it mean when your symptoms are improving, right? So I think we've all been sick, right, and not felt well. We either had a fever, we were tired, our body's aching, maybe we're coughing. You want to see some of those symptoms start to turn the other way. Do you feel like going back to those other activities? Are you feeling less tired, less body aches, less cough? Certainly we said no fever for 24 hours. Those are the things you want to see lessening, and make sure they are lessening over a full 24 hours, right? Not just a couple hours, a full 24 hours. And if you go back to those activities and you feel worse, go back home. Go back home, rest, get better, and then try again. Dr. Daskalakis, anything else to add?
No, I think you got it. So it's just people are really good at sort of figuring out how they feel. So use those symptoms as your guide. Thanks.
Okay, so our next question is, should people wait for the new vaccine in the fall or get the new dose just recommended by ACIP?
Well, I'll start. The recommendations for an additional dose are for just a few folks. It's for folks who are immunocompromised or those who are over 65. And that means you have to have gotten that first dose already, right? So obviously to get a second, you need a first. So if you got your first, great job. And you are eligible for a second dose. If you have any questions, always go talk to your doctor. Is it right for you to do that? As we were talking about, we anticipate a different updated COVID vaccine later this year. And so we want you to start making a plan now in your head. Okay, when I'm getting my updated flu shot, I'm going to get my updated COVID shot later this year. So most of us don't need a second dose of the current COVID vaccine. But if you're over 65, immunocompromised, talk to your doctor about an additional shot. Anything else to add?
Just have to double click that if you haven't gotten your first shot, get your first shot. So I know we're talking about shot 2, but let's focus on shot 1. We still have some work to do there.
That's right.
Very good. Okay, so will guidance change for healthcare workers?
Great question. This guidance is just for us in the community. Our healthcare guidance is not changing today at all. This is just for us in the community.
Okay, so why doesn't the guidance recommend the maximally protective options, like actively recommending masking for everyone?
Yeah, I appreciate this question. The good news is we are in a different place. It doesn't mean we were wrong back in the earlier times of the pandemic to do those things. We needed to. We were seeing huge amount of hospitalizations, huge amount of deaths. We all had never been exposed to this virus. We didn't have underlying immunity. We didn't have vaccines. We didn't have treatment. So we needed to take those other steps. Now, it's good news. We're in a different place. It doesn't mean COVID is gone, though, right? The important part about these recommendations is that there are still things to do. There are still important things we need to do. And I know we've said it a lot, but you're going to keep hearing us say this. Vaccination is really such a key here. And then if you're sick, getting tested and treatment are the most important things, if I was to lift out of this guidance, that you want to do. So that's why, today we feel comfortable having this simplified, unified guidance that you can take no matter what virus you have, particularly if you don't know what virus you have. We have steps to protect yourself going forward.
Okay, our next question is there special information for people who are immunocompromised because vaccines may not work as well for them?
Thank you. That's a great question. And so we were very deliberate, since really populations at increased risk for worse outcomes with respiratory diseases were really the top of mind in developing this guidance. There are more specific recommendations for the populations that I talked about. So folks more advanced in age, younger children, folks who are immunocompromised, folks with disabilities, as well as pregnant moms, very specifically because we have additional advice for them so that they can maximize their protection. Thanks for that question.
Absolutely. Can we also talk about how has health equity considerations been a part of this guidance development process?
Yeah, what a great question. First, I want to reiterate that, protecting some of our most vulnerable populations has been top of mind for us, and these guidance definitely reflect that. And I hope you see equity built into how we were thinking about the guidance. I'm really proud that the CDC, with leadership here at HHS, we were able to offer free COVID vaccines this past season, and we will do it again this upcoming season, right? Recognizing the most important tool here we have is those vaccines, and we don't want barriers such as cost to be an issue. So we're grateful to partnership with many pharmacies around the country, to our FQHCs and others who offered those free vaccines. We got to keep that up. But also we recognize that folks, that it is tough to follow some of the guidance that has been out there. And part of what we're trying to do today is give folks simple guidance that they can remember, that respects, that folks are coming at this from a lot of different places. So we hope that you see that built into this guidance. Dr. Joe, anything else?
No, that's great. Thank you.
Great.
Yep. So we know that our partners have an ear to the ground. How can they pass along feedback as this guidance is rolled out and implemented?
Oh, I love that. So look, these are updated guidance, but it's not new. Look, we've been looking at COVID guidance for quite some time. And so we've been listening to many stakeholders for many months and years on how to do this effectively. And look, it's hard to come up with any one solution, but you have to do it. And that's what we're presenting today. And we know it might not meet where everyone is. We're trying to make sure that we're giving simple, clear information that folks can follow. But just know that it is built on so much listening that we have been doing, and of course, looking at the data and evidence that we have. We want to continue to hear your feedback. That's so important to us. So thank you, one, for joining this, asking questions here. But we want to continue to hear feedback as we move through this. I'll also take the opportunity to say, look, this is what we know today. But as I say, the virus is changing, which is why we're updating the COVID vaccine for later this year. The virus is changing. This is what we know today based on what we're seeing in the underlying data and evidence. But that's why we have to stay on top of this. We're continuing to monitor the virus. We are making sure to stay one step ahead. If something changes, if our vaccines aren't working, if our tests don't work, if we're seeing increases in hospitalizations or death, we may need to do other things. But this is the best guidance we have today for you. And I hope that you see it being simple and easy to understand.
Thank you. Can you explain how we can say immunity is high but also wanes?
I think that's for the infectious disease doctor.
Perfect. I'll go back to some of the comments I made during the presentation. So we do have really good news from the perspective of where we are with population immunity. So over 98% of people have evidence of immunity either because of prior infection or prior vaccination. So that's good news. But again, as I said, that immunity is a subscription that we need to renew. And so it does wane. And so that's why vaccines are number one for us in terms of the strategy to really prevent respiratory virus, specifically COVID-19. So both are true. There's a lot of immunity, but we need to make it stronger and better by making sure that we are using updated vaccines. Thanks.
Thank you. So our last question, when will this guidance be posted online?
Imminently. So I was hoping it would be done as we were talking, but as of 1:00 Eastern time, this information should be up on our website, so you can read all of the detail there. We not only have guidance for you and some simplified pictures, but then we have some even easier explanations, because look, this is a lot, we understand. Even as we get simplified, there's a number of strategies here we want you to understand. But I think the most important, I heard last question here, so maybe just to share last few words. One is a thank you. We've pulled together as one team to fight this virus, COVID, for a long time. The good news is we're in a different place, and it's because of a lot of hard work. Thank you to the scientists for this vaccine that is protecting us. So we are in a different place, but we cannot forget that COVID is still here. Flu is still here. We need to keep protecting ourselves and each other. We have to use these core strategies to make sure that we are as protected as possible. Remember, not just about you and your individual risk, but who are you around, and what is their risk, and how can we make sure that we are protecting those most vulnerable among those, our family and our friends. And I know we all want to be safe and healthy as well. Dr. Celeste, anything else you want
I don't
to
know
add?
if I can top that. Thank you so much.
All right. Again, thank you to everyone for everything that you are doing to keep communities safe, getting this word out to folks. You're going to hear much more from us about how we can continue to work, particularly in getting folks to understand those core strategies, vaccination, hygiene, and improved air quality. So more from us as we go forward, but so grateful for your partnership. Thanks so much.
And thank you both for taking the time to do this today. We know that there were a lot more questions than we got to today, so we will take a look at what we have in the chat and work on getting something back to you so we can answer the rest of those questions. We appreciate you taking the time today. Thank you.